Okay, so I'm going to start with asking questions. Are you experiencing any shortness of breath?
No.
Any respiratory problems?
Nope.
Do you smoke?
No.
And are you having any productive or non-productive cough?
No.
No. Okay, and at this point I would be assessing like his pulse, and then without the patient being aware, I would be counting the respirations, and I would note the rate and rhythm, depth, and if there's any effort, and making sure that the chest is expanding symmetrically. Now I'm going to inspect his chest anteriorly and posteriorly, checking for the diameter, the costal angle, and looking for spinal deformities. If there's any respiratory efforts like heaving or nasal flaring, and the symmetry of chest movement. Now I'm going to palpate your trachea with my fingers. Is that okay?
Yes.
Okay. All right, no deviations. Everything feels normal. And now I'm going to, with the palm of my hand, feel your chest for masses and crepitus, which is bubbling under the skin, trapped air. And then you can let me know if you have any pain or tenderness.
Sure.
Okay, everything feels good. Now I'm going to go ahead and listen to your chest. And what I'm going to be doing here is asking for one deep breath through the mouth. And I'm going to be listening at each spot for a full respiratory cycle. So I'm listening, I'm waiting for the full respiratory cycle. Okay, and also what I was checking for is a symmetry of sound. Are they equal? Okay, now I'm going to have you turn around. Nope, okay. Okay, so now what we're looking for here is tactile fremitus, and I'm going to ask you to say 99 every time I move to a different spot, and we're checking for vibrations and symmetry.
Okay. 99, 99, 99, 99, 99, 99, 99, 99, 99, 99.
Okay, perfect. All right, and now we are going to go ahead and percuss your chest, and I'm going to be using my middle finger and tapping, starting at above the scapula, and I'm checking for resonance and symmetry, and I'm making sure that I'm in the intercostal spaces. Okay, everything sounds good. Now I'm going to go ahead and auscultate your chest. And then I'm also going to ask him to do the slow, deep breaths through the mouth, and I'm going to be waiting for a full respiratory cycle before moving on to the next spot.
Mom, look at this.
Yeah,
One
I know,
second.
it paused. Okay, everything sounds good. And then, can you turn back over this way? I would be looking for adventitious sounds, and also I would note normal sounds, which would be bronchial here near the trachea. And right here is bronchovesicular, and then vesicular sounds along the peripheral lungs. And then I did not hear any adventitious sounds like crackles, crackles, rhonchi, or crackles, rhonchi, which would indicate like pneumonia or fluid in the lungs. Wheezes, which would be an obstruction, as with asthma. Also stridor, which would be caused by croup or blockage. And no friction rub, which would be caused by pleuritis. And grunting with increased effort. Everything sounded normal. Now we're going to move on to the heart. I'm going to ask you a few questions. Are you having any activity intolerance?
No.
What about a history of high blood pressure, stroke, or any heart conditions?
No.
Are you having any chest pain?
No.
Great. Shortness of breath?
No.
Dizziness?
No.
And are you taking any medications?
I'm not.
Okay. Now I'm going to inspect your chest and your neck, and ideally I would have them at a 30-degree angle, and I'm going to observe the carotid and jugular vessels for pulsations, and then I would have them turn their head side to side and observe for pulsations, and also you can shine a pen light or something to help with the viewing of the pulsations. And now I'm going to palpate your carotid arteries one by one, and I would note the rate, rhythm, and the strength. That sound, they were equal. And now I'm going to auscultate your pericardium. So this is where I'm going to be listening for the heart sounds S1 and S2. Starting with the aortic valve here at the second intercostal space, at the right sternal border, moving on to the pulmonic valve, and Erb's point, third intercostal space, left sternal border, tricuspid valve, and finally the mitral valve at the fifth intercostal space, mid-clavicular line. And I would be using the diaphragm of my stethoscope, and if I heard any suspicious sounds, I would switch to the bell for low frequency sounds like heart murmurs. Okay, moving on. In addition to this, I would also listen to the apical pulse here at the mid-clavicular line, fifth intercostal space, for a full minute. Okay. Now I'm going to be palpating the brachial pulse. I find it here. Okay, and the radial pulse. And I'm going to be assessing the rate, the depth, and checking for also symmetry and strength. And while I'm doing this, I'm also checking for edema and also any vein damage, temperature, and looking for pallor. Now I'm going to go ahead and check his capillary refill time, which is in less than 2 seconds. That is considered a normal capillary refill time. Okay, Now I am going to don my gloves, and I am going to assess his femoral, popliteal, dorsalis pedis, and his posterior tibial pulses. Okay, I'm just gonna pretend like he's laying down. So the femoral would be here, and if I was having trouble, I would ask him to, in a frog like pose, bend your knee, and then find the pulse here. The popliteal is behind his knee, and I would be using the pads of my fingers. And here I'm looking for a rate, rhythm, and also equality. So moving on to the other side. Popliteal, the femoral pulse here near his groin, and then popliteal behind the knee. Oof, it's going to be hard to show. Okay. Then I would be looking for a pulse here, which is easy to obliterate at the top of the foot, the dorsalis pedis. Okay, and then I'm checking for equality on both sides. And then I'd hook my fingers here behind this ankle bone to find the posterior tibial pulse. That one's really easy to find. Okay. Oh. And then as a last step, I would check for capillary refill time. Again, the normal capillary refill time is less than 2 to 3 seconds.